Oh, I'm sorry, Kitty. All right, Mr. Parkers, I'm gonna go ahead and call the doctor for you, okay? Okay, ring, ring. Hi, my name is Sarah. I am the nurse taking care of Mr. Kenton Parkers here in room 148. He came in a little bit ago complaining of really swollen ankles with pain, shortness of breath. He is a 67-year-old male, and he does have an outstanding history of COPD and complications with his congestive heart failure. He doesn't really have any significant medical history that's alarming, other than the fact that he is diagnosed with COPD and congestive heart failure. Just going over my assessment, listening to his lungs, he does have crackles in the both lobes of his lungs. His pulses are +3 and slightly irregular. Going down, I assessed his legs for edema, and he does have +3 pitting edema. His posterior tibialis pulse was non-palpable, and his dorsalis pedis pulse was also non-palpable. Capillary refill in the bilateral lower extremities were greater than 3 seconds. So I am a little concerned about the swelling in his legs. Going over some of his labs, his CBCs, his white blood cell count was a little elevated. It's 11.2, so nothing too major to be concerned about, but I do want to monitor that because it could be an indication that he is developing some sort of infection in his lungs. The sputum that I had assessed, it was thick, it was yellow, and he did have a productive cough and was coughing up about 15 milliliters in a little medicine cup. Going down, his electrolytes look okay, but I am a little concerned about his ABGs. Just looking at them, his pH is just a little low. His PO2 is a little low as well. His O2 sats were at 89%, but I did titrate the oxygen up to 4 liters, and it did bring his O2 sat up to 93%. His CO2 is a little high as well, could indicate respiratory acidosis. So I would recommend maybe getting a culture and sensitivity test on the sputum, just to kind of rule out any infection, pneumonia, anything like that. I also would like to recommend increasing his Lasix for the next dose. He did already receive that this morning, but the swelling in his legs is pretty significant, so I would want to increase that a little bit higher. Okay, so I'm going to repeat the orders back to you. So we're going to do a culture and sensitivity test on the sputum stat, and also for the next dose, we're going to increase the Lasix to 40 milligrams. Okay. Alrighty. Okay, Mr. Parkers, I'm going to go grab your meds from the med room, and I will be right back, okay? I'm gonna put the bed down for safety, rails up. Is there anything else that I can get for you? Okay, here is your call bell if you need anything. I'm going to open the door and I'm gonna wash my hands. Okay, I am going into the med room. I'm going to wash my hands once I get in here. We're just gonna pull up the MAR. Okay. Table's falling over. Okay. So I have patient name, Mr. Kenton Parkers, MR number 7700213, no known allergies, date of birth 5/8. I'm going to be administering a multivitamin, 1 tablet daily, first dose now, due now. And in my hand, I have a multivitamin, 1 tablet daily. Expiration is 3/21. Okay, I have patient name Kenton Parkers, MR number 7700213, no known allergies, date of birth 5/8. I'm going to be administering acetaminophen 650 milligrams PO every 4 hours as needed for pain due now. And in my hand, I have Tylenol 650 milligrams. Expiration date is 9/23. Alrighty, I have Mr. Kenton Parkers, MR number 7700213, no known allergies, date of birth 5/8. I'm going to be administering a multivitamin, 1 tablet daily, first dose now, due now. And in my hand, I have prepared a multivitamin, 1 a day. Expiration is 3/21. I have patient name Kenton Parkers, MR number 7700213, no known allergies, date of birth 5/8. I'm going to be administering acetaminophen 650 milligrams PO every 4 hours as needed for pain due now. In my hand, I have prepared acetaminophen 650 milligram tab. Expiration is 9/23. Alrighty. So I'm gonna gather all my supplies. I'm gonna head back to the patient's room. This, I have my MAR open. Okay, knock knock. Close the door for privacy. Wash my hands. Hello, my name is Sarah. I'm gonna be your nurse for today. How are you? Good. Okay. Can you state your name and date of birth for me, please? Kenton Parkers, 5/8. Kenton Parkers, 5/8. Mr. Parkers, do you have any allergies? Okay, no known allergies noted, and the patient's not wearing an allergy band. I'm going to verify the MR number, 7700213, 7700213. Okay, Mr. Parkers, I have some medication for you. I'm going to do my third check. Kenton Parkers, MR number 7700213, no known allergies, date of birth 5/8. I'm going to be administering a multivitamin, 1 tablet daily, first dose now, due now. And in my hand, I have prepared a multivitamin, 1 a days, since they don't have doses. Okay, I have patient name Kenton Parkers, MR number 7700213, no known allergies, date of birth 5/8. I'm going to be administering acetaminophen 650 milligrams PO every 4 hours as needed for mild pain, due now. And in my hand, I have prepared acetaminophen 650 milligram tablet. All right, Mr. Parkers, I have some acetaminophen that should help with your pain in your ankles. And I also have a multivitamin for you, okay? So here's that. Go gulp. Okay. And I'm gonna document that I gave the acetaminophen and the multivitamin.